expand her charity work into India next year. Well, she's doing work in South Africa, India as well. We want to talk about the U.S. as well in the fight against HIV/AIDS. A lot of talk about healthcare reform these days, of course, but what about the proposals? How are they going to impact HIV/AIDS patients? We're talking about it this morning. We're going to explain how this impacts all of us, whether you have HIV/AIDS or not. Let's bring in David Munar. He's with the AIDS Foundation of Chicago. He's also living with HIV and determined to make sure lawmakers are held accountable and held to a higher standard. David, good morning to you, sir. We appreciate you being here with us. We've got 5 bills that we're looking at.
TJ.
And do any of the 5 proposals we're looking at so far, and you do believe that 1 or 2 or maybe 3 of them have a potential to be a game changer in the fight against HIV/AIDS. Why?
I do, TJ. I think having comprehensive health reform this year is critical. In the United States, there's about 1.1 million people living with HIV, and the epidemic in the United States is one of inequality. 1 in 3 people with HIV in the United States is uninsured, and about 1 in 2 are living below poverty on less than $10,000 a year. So proposals to expand access to health care will dramatically improve efforts to stop the epidemic.
Now, you believe, and you were telling me that you think the 3 in the House right now give you the best chance. Why do you single those out versus the proposals we see in the Senate as well, including the Baucus bill?
Well, the 3 bills are similar in many ways. One of the things that's important in all 3 of the bills is expanding Medicaid for all low-income people, regardless of whether they're parents or have no dependent children. And so those, Medicaid expansion by itself to 133% of poverty, around $14,000 annual salary, would bring about 100,000 people with HIV into coverage. But the House bill is superior to the other bills. It would provide a national public option, which we think is very important for the fight against AIDS, a national exchange, and it has specific HIV provisions to make sure that benefits around healthcare happen immedially.
So you obviously sounds like you see some hope in here, and this could, moving forward, specifically target and change the HIV/AIDS in this country. Let me ask you about something else while I have you here before I let you go, and that's about the HIV vaccine that there's so much news was made about a month ago. The studies were done over in Thailand. Some debate about how effective and how productive really those trials were. Did you see that as a new hope? Did you see that as promising? Or now that some more news has come out about those HIV trials, maybe it didn't sound as promising as it once did?
Well, the vaccine research study that came out is promising news for research, but we're not going to see a vaccine soon. And we do have already powerful medications that can control HIV and make people productive members of society if they have access, which is why health reform is so critical. About 500,000 Americans in the U.S. are living with HIV and do not receive regular health care. And that could change if we pass health reform, and particularly the House bill.
Well, it sounds like access to health care, an issue that so many others are dealing with, but specifically here this morning talking about HIV/AIDS. David Munar, again, with the AIDS Foundation of Chicago. So we appreciate you taking the time out with us and hope to follow up with you as these bills continue to move through Congress.
Thanks, TJ.
All right, Betty.
All right, so in an emergency, the latest healthcare advances could be in the palm of your hands. Yes, finding doctors in strange cities, getting emergency room wait times. There is an app for that and so much more.